the theme of the meeting, farm to table, food system biosecurity, is one that is near and dear to me as one, an American, and then two, as a parent, and hopefully as a future grandparent many, many years from now. But I really think that it is an important theme that we really need to be paying attention to. And I also think in studying the buying trends and consumer demands about the millennial generations and the generations that will come after them, this type of information and integrity of an on-farm type system is really what they're going to be looking for and demanding as they're looking at what kind of foods they want to buy, not just aquaculture, but in all of our agricultural commodities. CAHPS, or the Commercial Aquaculture Health Program Standards, started as a sidebar, backroom conversation initiated by the National Aquaculture Association, and really came out of a sector meeting that the aquaculture industry sectors had with the APHIS administrator, Mr. Shea, about, where is USDA and aquaculture? We really need USDA to step up and be a leader for aquaculture as an agricultural livestock commodity here in the United States. And so our administration heard that very loud and clear. We do have a MOU and a partnership with our other federal agencies, the U.S. Fish and Wildlife and NOAA, National Marine Fisheries Service. But through that MOU, it has delineated our authorities for farm-raised commercial livestock, including aquaculture. So the NAP, or the National Aquatic Animal Health Plan, was drafted and put out in 2008, and really since then has really had very little traction or movement in a positive direction, because I think it's been difficult for us to figure out, as U.S. Fish and Wildlife, APHIS, and NOAA, how do you implement a plan across all those, one, the diversity of the aquaculture industry, but then the very different perspectives of wildlife versus commercial livestock. So in listening to the industry and recognizing our relationship that is still intact with those other federal agencies, we really took a hard look at the NAP and tried to figure out how we could implement the NAP for commercial aquaculture. And so that's really where CAHPS was born. The industry also is very cognizant, and these are representatives from the NIAA that participated in this CAHPS working group, that we really needed to develop something that was meaningful, science-based, and that could be applicable across any type of aquaculture industry, and also applied beyond that, such that it was based on principles that truly had applicability in other areas as well, so such that it leveled the playing field, whether it was breeding fish for stock enhancement, for food systems, for recreational pet industries, that it was all the same. So basically, has anybody heard of CAHPS before you got here today? Yeah, a little bit? Okay. So CAHPS really basically is a farm health management plan. It is not a silver bullet. It's one of the tools in the toolbox for commercial aquaculture to use on the farm to set up an infrastructure for knowing what the health of their animals are on the farm. Because of the sentiment and what we were handed down from our leadership was that regulations are difficult, they are clunky, they are time-consuming, and often by the time you get them put into place, they are outdated almost as soon as you do that, and they're very difficult and unresponsive or unreflexible to change. So we really were tasked with developing alternatives to rulemaking, and so we came up with a voluntary, non-regulatory program, which clearly also has some challenges about implementation and oversight, but we are not thwarted by those challenges. But it was very important that the industry already has so many regulations. We did not want to add on to that already very burdensome environment. We wanted a plan that was science-based and that it was strengthened through cooperation and partnership with the other players who might be doing some form of aquaculture in the United States. And we could share that oversight with them such that the onus didn't fall particularly all at APHIS level, that we could share that with our state partners and other federal agencies. So very quickly, I want to share with you what CAHPS really is. So it's based on 5 principles. I always tease our farmers that I can never remember. If it goes off of the 5-finger rule, I'm sunk. I won't be able to remember it. So I have biosecurity on one hand and CAHPS on the other hand. So the 5 principles of CAHPS are there that you can see. And you can see there's really nothing listed here that is specific for aquaculture necessarily, but it is a really nice backbone for verifying and assuring animal health on the farm. And we're going to go through each one of these principles. First, it became very clear, and one of the big challenges in aquaculture in the United States is the availability of knowledgeable veterinary expertise in terms of animal health, aquatic animal health, and aquatic animal production. And it's not just veterinarians. When I was working at a dairy when I was doing undergrad, often it was the veterinarian, the nutritionist, the geneticist, the reproductive physiologist, the milk somatic cell count people that would come in. And it really was this team of people that worked together with the management on the farm to develop a health plan for those animals on the farm. Now, I am a veterinarian, and I would advocate that it's appropriate to have a veterinarian involved in that process. But if you aren't moving animals interstate or internationally, and you don't need a health certificate of any kind or a statement of veterinary inspection, you might not necessarily need a veterinarian in this process. There are certainly other qualified and highly knowledgeable people here in the United States, the American Fisheries Society certified professionals, laboratorians, and what I have found often, particularly down in the Arkansas area, is that the relationship about animal health is developed from the farm and the laboratory that's doing the diagnostic testing. And often, unfortunately, the veterinarian is simply the person that comes, looks at the test results, kind of does a look around the farm, and then automatically signs their name issuing that health certificate. That's not what we're talking about. We want everybody fully integrated and knowledgeable in this system about what's going on the farm. They obviously have to be actively engaged with the site. Veterinarians do have a responsibility of fulfilling a valid vet-client-patient relationship, meaning that they are intimately aware of what is going on the farm. This team also has to establish, as part of CAHPS, a communication plan. Down in Florida, when I'm working with some of our folks, they're like, well, what the heck does that mean? I mean, I talk to my veterinarian whenever I need them. Well, quite honestly, I don't really think that's enough. We are in a world that now requires documentation for verification of that. And really, this is not about being prescriptive about how that gets done. It can be done through an email with that team. It can be on a monthly basis about morbidity and mortality rates, drug use, issues that might be going on. A lot of times in aquatic animal health production, we see things that are very seasonal, or we have times of the year when the animals might be more at risk, such as harvesting or seining, when we see diseases pop up. And this team then would also be have to assist with the site-specific health plan development, which I'll talk about towards the end here. The next principle is risk evaluation. I always hesitate using the term risk assessment because that tends to glaze people's eyes over. But again, I'm sticking to my with on one hand rule, where risk evaluation to me is comprised of 3 things: risk identification, risk characterization, and then finally risk management. So to begin with, we have to identify the pathogens that are of concern for the farm, for the species that are being developed. We are not going to keep pathogens off of every farm, and it's not needed to do that necessarily. We need to have a very targeted approach for the species being cultured about what pathogens we're trying to avoid the introduction to or prevent the spread on the farm. Once we've identified those pathways of risk for the site-specific area, we then go through the process of risk characterization, which really determines the degree of risk, how bad might it be in terms of breaches in the introduction or spread, the scope of that risk, and then also the impact of that risk. Obviously, not all pathogens are created equal. Here in the United States, we have a number of internationally reportable aquatic animal viruses that are already endemic here in the United States. For example, we've got KHV. It's an OIE-listed disease, but we already know that it's widespread here in the United States. So are we really going to be effective at eliminating or eradicating that disease from our country? Some of our sectors, particularly the hobbyists, would like to see that, but we don't see it as a huge problem down at the production level. And then, of course, we do have other very serious diseases, particularly in the shrimp and mollusk sectors, of exotic or foreign animal diseases that we need to make sure that they are protected against. And finally, as part of the risk evaluation, we need a comprehensive and integrated surveillance plan that takes into account the risk evaluation that's being done, and that we base that surveillance plan on the degree of risk that we've identified for the farm. And that's done, obviously, through risk management. Risk mitigation strategies, which in my mind are encompassed primarily in these two activities. One are the early disease detection systems, which require training, on-the-ground training and management for the people that are working with the animals on a daily basis. If they don't know the clinical signs or the primary indicators that something's not right, I often tell the farmers it's that kind of that squeeze in your gut when you know your animals really well and you just kind of know something's ADR, right? Ain't doing right. And that's a primary indicator that could be an early sign of disease, whether the animals are off feed, fertility or fecundity is down, and those can be our early signs, and then they need to know how do they appropriately respond to that. We also need to help, and if anybody can help me, this is an area I desperately need help on. I am not a mathematician or a statistician by any stretch of the imagination, but it is very important that we have the tools, and we develop the tools that is easy for sites to develop and know what their site-specific thresholds are for morbidity and mortality. Again, it's probably going to be based on the species, the production method, and the season of when we're going to see these, but we need to know what is an acceptable level of morbidity and mortality. I've talked to a number of different people in the industry, and they're like, well, we never have a dead fish. Yeah. Or dead whatever.
A lot of flying buzzards.
And so, and that's an indicator. And that's an indicator, right? So, but then I also talked to some where, possibly 200 dead fish a day, that's normal for them. And so every site is going to be very different. And so how do we help them and the people that are working on their farm and with their animals know when to have that little bit of a tighter squeeze, that something's not doing right and we need to take action immediately. And so we need to have those site-specific thresholds established. Finally, biosecurity. Now, we heard a lot about biosecurity this morning, and really my thinking on biosecurity has evolved over time. And for me, biosecurity does not work by itself. It just doesn't. And we can tout the 5 risks of biosecurity in an aquaculture setting, which are the animals, water, feed, vectors, and fomites. But without the integrity of the rest of the system around it, such as early disease detection systems and surveillance and communication of an aquatic animal health team, it becomes a useless tool. It's not to say that it's not a big part of this, and I gave a lecture over the weekend to some graduate students on farm health management. And they were, biosecurity is farm health management. Well, depends on what your definition of health is, right? If it's just that you're free of disease, then maybe biosecurity is your definition of health. But to me, health means a lot more than that. And so, not to downplay biosecurity, but I think biosecurity can be, as we heard this morning, its benefits are often intangible. And it's a hard sell a lot of times because the impact of how we operate biosecurity is sometimes very nebulous because we don't appreciate it because hopefully everything is going well. Also in aquaculture and in some other commodities, not all foot baths. The way of thinking of biosecurity in our global world is very different. It's not enough to say, oh, well, I have foot baths, I have hand sanitizers, and dedicated equipment. That's no longer an acceptable answer. It's why do you have the foot baths? Why do you require people to hand sanitize? Why do you have dedicated equipment? What are you worried about? And are you worried about it at the appropriate level? Too often I go out to farms and they've got, the foot baths sitting outside. I'm down in Florida, by the way, so everything is outside. They've got foot baths sitting on the outside of the greenhouse. Is the efficacy of that disinfectant that they put in there going to be doing anything by the end of the day, sitting out in the elements in Florida? Likely not. And so it becomes a very false sense of security that is likely not really doing anything. Plus, it's expensive to keep doing that every day, and then the people get sick of doing it because, what ends up happening is it gets dirty. And then the second I come by with my, leopard-covered shoes, the guys or the gals like, oh, Doc, just step over that mess. And that's a big problem.
Or the test strips are outdated.
The test strips aren't available. I mean, that's a big concern right now, too, is we're advocating the use of Virkon because a really great tool for using Virkon is the test strips. You can't find them. Plus, they're super expensive. But we have done some studies in aquaculture settings how long those Virkon baths last. And that's what I advocate to our producers, too, is invest in one bottle of the strips. And for every foot bath that's on the farm, go around and determine what the pattern or trend is for that foot bath. So that for that foot bath at house A, we need to change it every 4 days. Whereas the other foot bath at house C has to be changed every 7 days. And know what they're dealing with that way. Okay, so risk management, the strategies, early disease detection, and biosecurity. The linchpin in this whole plan is for surveillance. Without surveillance, we don't know what we don't know. It's that famous Rumsfeld quote. We don't know what we don't know because we don't know it, but we know that. So again, surveillance gives us the opportunity to know what's on the farm. And again, this is very pathogen-specific, targeted surveillance. And we have to know why we're doing it. Are we trying to establish freedom from disease? Are we trying to at least know the disease level or the prevalence of the disease that we have on the farm? And then how are we going to apply that? Is it just for my site? Or, as we heard about a comment this morning, was regionalization, right? The zone. What can I say about the zone? And creating those zones takes partnership with other industry stakeholders and also surveillance going on in the wild populations. So there are a couple of different strategies on how to achieve surveillance. The easiest and most often done, but least recognized, is observational surveillance. Usually producers are doing observational surveillance every day. And some of them are taking notes. A lot of them are taking mental notes about, hey, that one didn't quite do that. But they are doing observational surveillance, and that is very important. We're piloting CAHPS down in a tilapia industry in North Carolina, and they don't have any internationally reportable disease. They are not required to do any specific surveillance for specific pathogens to move their product. And so I told these guys probably observational surveillance is going to be the most appropriate method of surveillance for you. It's not that it's any less, it's just it's going to be that much easier for you guys, but you have to document that type of information. Then we have risk-based, and the global community really is moving more towards this risk-based approach of surveillance, such that we can start off by testing, say, 175, 150 animals twice a year when we know that we're going to find the disease. But then risk-based surveillance, again, is based on that risk evaluation that we just went through, such that we can use the power of that information to make decisions about how we can do surveillance in the future, get more bang for our buck. sometimes, in my opinion, we are, because of the different patchwork of regulations across the state, we are asking our producers to do so much testing, it is becoming absolutely meaningless. If we then start with risk-based surveillance, looking at, say, only the moribunds or fresh deads, aren't those the samples that are going to yield us the most high-quality results? If it's there, we're definitely going to be finding it. So again, observational and risk-based surveillance. The fourth principle, disease investigation. These are going to be triggered when we have exceeded those acceptable thresholds on the farm. And again, the scope of that response is really going to, or investigation, is going to depend on what pathogen we think it might be, and then how significant or virulent the impact of that pathogen is on the population that we're growing. For example, ick is a very common pathogen. It can be very problematic if it gets out of control, but doesn't require, say, me to show up in my white biohazard suit to respond to that. We also have to know, for the disease investigation, what's the quality of our diagnostics? How much do we know the sensitivity and specificity of those diagnostic tools, such that if we get a result back, we know that result to be true? And again, we have pathogens this day and age that require reporting. Now, again, depending upon what that pathogen is going to dictate what that reporting consists of. But for some of our internationally reportable disease, that is going to require communication outside of the farm to APHIS, who then will decide how that gets reported on an international scale. But again, that's not for all pathogens, and probably for very few pathogens that most of our aquaculture sectors are working with. And finally, we get to response. There's a great General Patton's quote is, a good plan today is better than a perfect plan tomorrow. And that there's another one that about, something about planning, and once you have a plan, the first thing that goes out the window when there's a problem is the plan. But contingency planning, we need a straw man to base, like what they were talking about with the security of the eggs and the cattle and that kind of thing. We need that type of straw man so that we're not starting off cold in these types of outbreaks and situations. The type of outbreak is also going to dictate what our treatment or other options are as a result of that outbreak. It could be simply treating. It could be simply just leaving the animals alone and letting them recover on their own. Could have simply been a non-infectious disease process that we were seeing. And then, of course, have that opportunity to reflect back, update the plan, change it if you need to, and incorporate everybody's input into that plan so that we can get recovered and back into business. So those are the 5 principles of CAHPS. And so what is really nice about CAHPS, in my opinion, is that it is an assurance of the health of farm-raised aquatic animals. Animals may be considered lower risk for specific diseases because of the integrity of the biosecurity and surveillance plans that are part of this more broad infrastructure. It can facilitate animal trade and movement. A plan like this, even though voluntary and non-regulatory, can provide APHIS with leverage to go into discussions with international trading partners. Right now in the United States, even though we have the NAP, we do not have a national aquatic animal health system. And so this type, if adopted uniformly across all aquaculture industry sectors, recognized by state partners, could lend to that type of leveraging tool for APHIS with our trading partners. And not just our international trading partners, but also our domestic partners, our state partners. So that right now there is a patchwork of regulations for the movement of these animals. If we can provide some consistency and uniformity to that, if you are participating in this program and state X, Y, or Z recognize that your participation in this program, we will allow your animals to move into our state because we know that you're doing surveillance, we know that you have biosecurity, and we recognize that. Then we have marketing and branding. increases the public trust, which is the theme of our meeting today, and demonstrates this awareness of standards for the consumers, as I mentioned, with the millennial generation, who are very interested in knowing where their food has come from. Not just from a wholesomeness, but these guys actually really care about the animals, and I want them to continue to eat animals. I don't want, the world cannot become, no offense, vegetarian and vegan. They have to want to eat meat. That's how we're going to survive, in my opinion. And so it demonstrates from an industry level our awareness of those trends that we're seeing for buying powers. And CAHPS can be used as a complement to other programs. The theme of this meeting, food system biosecurity. It could complement a program such as that on the farm. Food safety. We are working with FSIS partners who just took over the catfish inspection program from FDA. If they would allow CAHPS on the farm to manage the health of those animals, and then once the animals get to the processing plant, then we can determine the food safety component from avoiding contamination and that type of thing at that site. Certification programs. We already have a number of third-party certifiers here in the United States for aquaculture, but we also have a number of very good state programs, such as the one in Arkansas, for their bait and sport fish farmers. We aren't looking to replace that. We are looking to give it more power and more leverage to get done what those guys are investing already into that program. Animal welfare. Let's face it, it's a big issue out there, and how can we begin to address that by, I know you guys have been talking about key performance indicators within this group. We can certainly address some of those components within CAHPS. And yield verification studies. We don't know the success of this program unless we know that it has a positive impact in the wallet of the producer, but also that it's making a meaningful impact on how those animals are being produced. So again, it provides the benefits. It provides a national health standards for commercial aquaculture. It's an auditable system. It has oversight and documentation, whether that's at the federal or state level. And then it's flexible and responsive. It's scalable to surveillance strategies, so if we need to, we were very reluctant to put in a specific number. Everybody, well, how many fish do I have to test? Is it 30? Is it 60? How many? We were very reluctant to put in a solid number because surveillance needs to be responsive to the pathogen that you're looking for and the production method that that's being done in. Also, we wanted to be cognizant of emerging pathogens. We don't know what we don't know that's out there already. And so we needed to be able to work that into these systems. And by engaging the early disease detection systems and the thresholds on the farm, we think we've addressed some of these risks that may be out there. So this is a schematic. People groan when I show it, but I'm a very visual type person. So when I say to somebody, okay, you've got to write a site-specific health plan, when I think about this, this is how I would approach doing it. Across the orange level, we've got the 5 principles of CAHPS. And then under each one of those, I would expect to see some documentation for the farm, the site-specific, about how they are addressing each one of these things. And so I would expect every farm that wants to participate in CAHPS would have to have this document. This document would be reviewed by APHIS or at the state level for integrity, and then we would go back and make sure that we've got the testing results from the surveillance, that we're using appropriate diagnostics that are recognized as being a verified study. CAHPS also, while we have the specific site, can also be applied for compartments, which are going to be even more biosecure entities. We know that aquaculture is done primarily in open environments, but we can do some very specific things to have an integrated system of animal production in some places. We've got some trout industries here in the United States that essentially, according to the OIE, can be considered compartments. And that becomes a very important selling or marketing tool for them on the international level. And then we can have the zone, which I talked about earlier, that becomes this region where we know either the prevalence or absence of specific pathogens in that disease, and such that all the power of testing that's going on in that zone all plays together to become a very powerful area. And animals can move then within this zone when we have concerns about that specific pathogen or pathogens that we know about. And therefore, we're eliminating some of those barriers to animal movement. So where is CAHPS Now? Within the month, we have these documents on our website, by the way, but I expect to be releasing our new revised plan later this month. It's been branded with the CAHPS logo and everything, and it's a very pretty document. It's about 50 pages, and it'll be about 50 more pages with appendices and checklists and templates in the back. I am trying to find a group that, like agplan.com, I don't know if you guys are familiar with that, but it's a platform that allows the farmer to freely access online a means to write a agricultural business plan. If I could also get that available so that people could do their CAHPS plan and just fill in the information, have some examples of what would be appropriate information in those, and then they can print it out, send it to anybody in their team, that's my dream. I don't want the documentation of this process to be the barrier. We've been holding discussion groups, and from those discussion groups you can see there were about 8 overarching themes that came out from those discussions. But largely we had multiple people participate in these, and support for CAHPS was very good. Buy-in was a concern, diagnostic consistency, benefits, and cost obviously all came to the top of the list as concerns. We've given many presentations, and we've even had 2 publications come out in a couple of different lay journals that way. Also, I am not a business person. I get paid no matter really what happens, thank goodness. But I realize that the people that I am working for to serve, protect, and promote do not have that luxury, that they are dependent upon what they're producing to feed their families. And so I can't, with good conscience, be recommending something that I don't know what the impact of that will be. And so APHIS has put time and money into determining the cost-benefit analysis of a program like CAHPS. We've done a cooperative agreement with APHIS and University of Arkansas at Pine Bluff with Dr. Carol Engel, who was formerly there, and her graduate student, Jonathan Van Senton, specifically for the bait and sport fish sector. And what they were able to determine from that year-long survey, I think it was about 9 different states that he went to, and had a very good response rate to the survey, that the benefit of CAHPS would really be seen by the access to previously foregone markets that those guys weren't able to sell for whatever reason, because they didn't have a health plan, because they weren't seen as a brand, that type of thing. And then here we see some other data that we really wanted to compare what the regulatory burden was, again, specifically for the bait and sport fish industry. It's going to be different for all the other aquaculture sectors, what this burden was. And in the future, the perfect world, right, how could CAHPS help alleviate or reduce some of these burdens? And we see those numbers there. Particularly this one on the bottom, that currently for that sector of the aquaculture industry, $12 million annually in regulatory costs could be reduced to $5 million. That's pretty incredible. And some of these guys had to have over 200 permits per month to move their animals. And again, that burden would be directly reduced. Other projects, we're going to do the same thing. We just got approval for funding to do the same type of survey with the Western Regional Aquaculture Centers, Virginia Tech, and now also Carol Stone Aquatics through her private consulting company, and we're going to go through and do the same thing. My hope is that every year APHIS will partner to recognize where those burdens are. It is useless for us to come up with a plan where we don't know where we can have the best impact. From that study, one of the most expensive activities for health certification on the farm was not the testing itself, not the diagnostics. It was the time and labor to the guys going out, spending in the ponds, seining up the animals. So how can we do that better? How can we do that smarter? And again, I'm hoping that CAHPS provides that structure to get that done. We're also working with the Maine shellfish folks to develop a zone for shellfish such that they can freely move and trade their animals from that zone. Also, then they know what the prevalence of those diseases or absence of those diseases are in their area. So what's next for CAHPS? As I mentioned, we've got that pilot that's just brand new with the North Carolina Aquaculture Association and Fresh Keepers. It's a tilapia co-op with about 6 growers. We've already established their aquatic animal health team, and we are now beginning their process of risk evaluation, where APHIS will be on site to go through those risk evaluations for the cooperative. Now, they have said, CAHPS is not one size fits all. It's not going to be for everybody. And so one of my questions to them was, do we come up with one CAHPS for the co-op, or do we come up with 7 different CAHPS? And the answer was, we can probably come up with one, but it's going to have to be tweaked for each different farm. So I'm a good tweaker. Then we have the cooperation with the eastern shellfish growers, and then the outcomes from these 2 different pilot programs are to identify the challenges for the implementation, to create the templates and checklists such that we remove these obstacles or burdens from the program and we can become very streamlined and hand a packet or tool, whether that might be on the internet or something else, to do that. And then do these economic assessments. We want to know how CAHPS will be used, how CAHPS can be applied in this situation, but then how it can be applied wider, and what are the broader picture things, tools that we need to have to develop it so it applies for all aquaculture industry sectors. So again, we want to make sure that during these pilot programs we are collecting the data such that we can do an economic impact study, such that we can calculate the economic estimates with related to costs. One of the big questions we were always asked, well, how much is CAHPS going to cost? And well, it's nothing to participate in CAHPS, but that's very different than what the bottom line impact is going to be out of the pocket. And so we need to be able to determine what that is. And again, yield verification studies. If we're growing more animals with less chemotherapeutics put out there, or we're just growing them better, faster, we're recognizing diseases earlier, we're going to have a more positive impact on the number of animals that are coming off of those sites. Recently, again, in preparing for this graduate student lecture I did over the weekend, I became very in tune with these SMART goals, which are the specific, measured, achievable, relevant, and timed and targeted, time-based and targeted goals. And so I just developed a couple of these out of my mind. These are not my supervisor approved, but really how can we increase CAHPS participation by fiscal year 18? And again, of course, that's running a number of different pilot projects, not just for the tilapia, but I want to get into other industry sectors so that we really do have a very good feel about how these can be run. But as we heard this morning, it costs money, right? And so our program, in comparison to some of the other ag groups within APHIS, is very small budget-wise. And so those are just some of my SMART goals for measuring the success of CAHPS within the next couple of fiscal years. This is not a new concept at all. And we have been trying to do this for years and years and years in aquaculture. And really, I encourage everybody to let the past go. And if we all work together and really be forward thinking and positive thinking and in partnership, that we drop, well, we can't do that because, but we really look forward to the time we can if we do this. And so I'm constantly looking for the ... What comes after that? How can we do this? It must be doable. It has to be doable. This is how it really has to go. And so how can we do this? So I'm looking constantly, seeking feedback on that. So these are our web pages. I know you guys will be receiving these slides, but we have our documents listed there on our aquaculture web page. We have an anonymous email system set up for feedback if you feel like I'm too threatening or mean. But again, I am always soliciting feedback and input on CAHPS. I want it to work, and I really believe and feel very passionately that it's the way the aquaculture industry in this country really needs to go.